The topic of today's lecture is protein synthesis inhibitors and the antibiotics that inhibit synthesis of the protein influence the ribosomes of the bacteria. And main classes of the antibiotics that inhibit protein include the tetracyclines, aminoglycosides, and macrolides. So these are three main. Also, the new groups include glycylcyclines and lincosamides and oxalidonides. So these are new one. And also, chloramphenicol is chemically different from all these, but still have the same mechanism of action. And also, the quinopristine and dalfopristine are a combination of the drugs with the same mechanism. So, in general, the selectivity of the bacterial ribosomes is not complete because the same size of the ribosome can be seen in mitochondria, and that is why the selectivity is not complete, and that is why there are some adverse effects. And the tetracyclines are named tetracyclines because they have 4 fused rings, and the substitutions in these rings make the different tetracyclines different from each other, and also can influence the spectrum of antimicrobial activity. So the mechanism of action includes the inhibition of the binding the transport RNA to the matrix RNA. So this is a S3 subunit of the ribosome.
Sir,
Yes,
excuse me.
sure.
It's just a chemical compound. It's like the chemical compound, or it's not.
What do you mean, like chemical compound?
No, I mean it's the chemical compound of all, right?
It is a chemical compound of what?
Of all the medicines which you show us before.
Do you mean that tetracycline?
Yes.
Yes, it is the chemistry. So the common thing with the all tetracyclines, they have 4 fused rings. So this is in the structure of the molecular.
Okay, I understand. Thank you.
My pleasure. So let's continue and with the mechanism. So if you have a question, please ask immediately. Don't wait when we skip to the next point, because when we return, then it's actually confusing for someone. So don't be shy and ask just when you have a question. Especially, I'm not very good in explaining some particular
Okay.
things first time, so that is why excuse me for that. So this subunit is
It's okay.
S30. So the this is a bacterial ribosome with 2 subunits, S30 and S50, and the tetracyclines will influence on the S30 subunit preventing the binding of transport RNA to the matrix RNA. And we can also discuss the mechanism of action of other antibiotics, so we don't need to return to this question today. So because this is most boring thing about the antibiotics. And the aminoglycosides are a second class, and they also bind to S30 subunit, and they have different mechanism of action. They lead to the misreading of the codons of the matrix RNA. So when these codons are recognized by the matrix RNA, it will connect a specific amino acid, and this misreading results in the wrong amino acid here, and that is why the protein is not correct, will be not correct, and then it will not be active. So then these both act on the S30 subunits, so tetracyclines and aminoglycosides. Opposite, the erythromycin and clindamycin will act on S50 subunit, and they will inhibit translocation. Translocation is the process of switching from the one codon to the next codon. So this is triplet on the matrix RNA, and the ribosome will move from one codon to the next codon, so they can read the genetic information from the matrix RNA. And this translocation, this process is called translocation, because they locate from the one place to another place, like not transportation, like you take a bus from the main building then to the pharmacy building. This is transportation, and this is translocation, because this change the location on the matrix RNA. And then chloramphenicol is inhibiting the peptidyl transferase. This protein will transfer the ribosome along the matrix RNA, and the new drugs, linezolid, binds to the S23 complex, actually S23 subunit of the ribosomal RNA, that preventing the formation of the initiation complex. Initiation complex is required to start the process of the coding, of the process of the translation. So this entire process is called for translation. And that is why the protein synthesis is never started. So this is the new one drugs. So this is the mechanism, was the mechanism of action for all the protein synthesis inhibitors. All of them inhibit them the different way, but the result summary is the same. the protein is not inhibited, and that lead to some consequences. And the antibacterial spectrum of the tetracyclines are broad, and they are bacteriostatic antibiotics, and they are effective against gram-positive cocci, including Staphylococcus aureus and Streptococcus pneumonia. This is also covered by the penicillins, and also they cover the Bacillus anthracis that will lead to the anthrax, but very rare now. So, and this is all with the gram-positive bacteria, and the gram-positive bacteria coverage is less than with the penicillins and cell wall inhibitors. So they don't include the diphtheria. Actually, Corynebacterium diphtheria is not covered. Then the gram-negative flora is represented by the Brucella, Vibrio cholera, that is will lead to the cholera. Cholera is a very dangerous disease, and we had a cholera outbreak in Kazan about 15 years ago, and that actually happened in near my home, so on the river that is near my home. So when I was young and was at school, at secondary school, during the summer practice, we visited that river to swim in that river. Our so most of the pupils during the summer practice like made some cleaning in the building, so like something at the yard, but instead of that our teacher gathered us together and said, let's go to the camping, and then we go to the woods, and there was a river there, so we swam in that river and then make some food at the fire, with the fire. So this actually was a little camping during the summer. And then several years later, the cholera outbreak was exactly in the same river that we were camping nearby. So actually some of the students that were there can get that cholera and then bring it to the home, transfer it to their parents, and their parents go to the work, transfer it to their customers, and then they transfer it back to their children, and etc. etc. So there was a cholera outbreak. So, do you know how the epidemiology was started?
For cholera?
Sorry?
Which allergy, sir, again? Which allergy?
Not the allergy. Do you know how the science of the epidemiology was invented?
No. How?
No, you don't know. So
No, sir.
it first it was started like in London. When in London there was a cholera outbreak, and no one was not aware what is the reason for the cholera outbreak. And
It's. I think it was because of mouses and.
no, it's
Uh,
No, no, it's different things. Allah.
the mouses is not the cholera, it is the it is
تعاوننا.
Yersinia pestis. It is the reason for the another outbreak that is more dangerous. It's killing the people better. It's the actually it is Yersinia pestis. It's not here. Okay, so I will tell you later. So about cholera,
Yes.
it was
But
unknown disease.
so
Like
it's the cholera. It's not from the water.
Yes, from the water.
yes, it is from water. Exactly.
Yes.
And
So how it begin, right?
sorry.
You mean how they how it's how it begin the cholera, right?
Right. The cholera begins usually with the contaminated water or food, but
Yes.
usually
Mm-hmm.
with the water, because water in medieval times in London there were no central water supply, and that is why the citizens used wells. Do you use wells?
Yes, sir.
Really? Where?
Yes.
Where do in Egypt?
No, we don't have, sir.
You don't have, but still,
Mm-mm. But I saw it
you saw.
before.
Okay, good.
Mm.
So and in London, actually, instead of the wells, there were a water supply, like uh, uh, water supply unit. When you it is automatic. It was automatic, so you don't need uh, to to move it with the hand to get to the water. You just put your a bottle and then press the uh, like there was a stick. You press the stick and then it will give you the water. Do you know this?
Actually, no.
No.
First time.
No.
I
But
think
good information.
it is one moment. It is water station.
Ah.
One moment, I will try to show you. This one. Yes, this one. Do you see this one?
Yes.
Yes.
So we have them in Kazan too,
It's the water which is going down from the earth, right?
right?
Which we something like big. We have it at home before when we had a war before in 2003. We had a war with the Americans, so we didn't have water at all. So we make all this in our gardens.
Okay, so
Yes, also we have it in our old, like in Egypt, in all the houses there are a lot of this, but
okay,
now it's not.
so
Yes, I understand.
so and there was this thing in London, and then but no one was not idea which of them is contaminated, right? And no one is not aware that it was because of the wells, because of the water. So and the one physician noticed that in particular region the people were ill more than other regions, and then he take a map and put the all the patients that live. So he put the dots on the houses of the patients that were ill. So because in London the physicians were coming to home instead of the coming to the hospital, so they know the address where the patients were living. So and they made a map, and then they connected all the houses with the lines, and then it's like the all lines crossed in the center of the area. And then they look what is in this center. what is situated there at
مصطفى
that
من فضلك
area,
اقفل الصوت عندك.
and they found out
So,
it was this thing. They
Well,
found out this, and
Mustafa.
after that they go to the authorities, to the government, and ask to close this well.
Excuse me,
Yes,
okay.
Busha, what?
Mustafa.
Huh?
What?
ممكن تغلق الصوت لأنه عم يقطع صوته. تمام، شكرا.
Busha, also shukran, but what do you want?
I told him to turn off
Microphone.
yes.
Okay, good. So if you have a noisy environment, then try to not be very noisy. Okay. So, and authorities refused to close the well, because if they close the well, then the citizens will comply that we don't have water, and that is why they will not vote for those candidates at the elections. And that is why the authorities rejected the proposal of closure of the well. And then the physician go to this well and cut this stick. They cut it, removed, so no one can use this anymore. And then the epidemic is complete, is resolved. So they just broke the well. So the first epidemiologist was actually a vandalist. So he broke this thing, the water supply station. So and then actually he write about an article about that, and then the epidemiology started to
Yeah.
or develop. So actually this is like a true story. And everyone then forget about that, but some still remember. So that is why make sure that
Interesting.
yes, it is. The history is very interesting. So that is why cholera is actually the reason for epidemiology to develop. So nowadays epidemiologists, like, they are also like during the recent outbreak, they were also involved uh, in the saving their lives. So they save many people's lives. So that is why all these measures that we are making now, they are from the epidemiologists. So we should tell them thank you very much. So they save our lives. So, but no one sees them.
Yes, of course.
Then so, and no one knows about
Yes.
them. So okay, cholera is caused by the Vibrio cholera, and is usually from the water or contaminated food. So then also the symptoms of cholera are the diarrhea, and because it multiplies in the GI tract, and the treatment is usually doxycycline, which is very effective, and also the fluid replacement is required. Doxycycline is actually the most useful tetracycline of all of them. So that is why make sure that you have a doxycycline in your pharmacy. And Mustafa, you probably need to order doxycycline from your mom. What do you think?
So I think we have it. It's the same doxycycline
You have?
or not?
Okay, good. So looks like your mom is very good pharmacist, because she give you this good medicine. So doxycycline is actually the
Yes.
best one.
Yes.
So then the Yersinia pestis is the cause of the, one moment, I forget what is. Yersinia pestis is not commonly seen because it's black. Yes, it's black. So, or Black Death. So the plague was in London, actually, like was very very there were several outbreaks of the plague in London and in Paris also. Bushra, do you know about the Paris outbreak of the plague?
Yes, but I don't have enough information.
Enough. Okay. Maybe
No.
you want to prepare a report in French about that,
Okay.
so we can study French a little too. So then the anaerobic organisms include Clostridium perfringens and Clostridium tetani that will lead to the intestine infections, the pain in the intestine, and they can lead to the perforation of the intestine that is very dangerous. So try to avoid these bacteria because they are very hard to treat. Then the spirochetes include Borrelia burgdorferi is type of the Borrelia that will lead to the Lyme disease. It's also very dangerous because Borrelia that lead to the Lyme disease, and Lyme disease is lethal, like will lead to the death if not treated promptly. And it is transmitted by the bite of infected ticks with the flies, and that is why when you go to the woods, make sure after you go out of the woods, check your skin, entire skin. So when you return at home, put your clothes off completely and check if you don't have any ticks on your skin that will suck your blood. So because they can transfer the disease. And infections symptoms include the headache, fever, and if not treated are followed by meningoencephalitis and eventually arthritis. So meningoencephalitis is very dangerous, hard to treat, completely untreatable, and also skin lesions can be seen.
And diarrhea also.
Diarrhea is not common. The Lyme disease is central nervous system disease. Bushra, why do you think diarrhea also?
Because some
Somewhat. People
because I mean
about the Lyme disease?
article, yes, and I saw they have a common symptom, yeah, I mean diarrhea and fever, and I forget the third one.
Maybe confusion, I think. On the
What?
end, like
Maybe.
confusion when they confused, they don't think well.
Okay.
So this is a common symptoms of the Lyme disease, and also the rash is like a bull's eye. It has a red on the center with the erythema, and also the doxycycline is the drug of choice for the treatment. So actually, if you take doxycycline right after the after infection, then the disease is not developed at all. So the earlier you start the treatment, the easier to treat the Lyme disease. And once there was there was uh, uh, a gathering of the in the uh, in the woods. There was, so in America there was a gathering of the nude, nudists. So and they make a like a conference, like but in the woods. So and all people there were nude. So there is a form of the culture that supports the not wearing the clothes. So these are nudists. So and they have a gathering in the woods, and then there was a report of the headache and fever, and the authorities supposed there was a Lyme disease outbreak. And then the Center for Disease Control and Prevention moved to that place and made a check of all the people, but they could not find any ticks or bites on the skin, because ticks usually bite in the shade, not in the open places. Like when you have a hand, they will not bite in the hand, they will bite in the near the clothes. So there is some shade, because they don't like the shade, they don't like the sun. So the ticks like somewhere here or here under the clothes, where they open, half open, so but not completely open. So that is why or somewhere on the legs, usually when you wear a short. So uh, they don't like the open, they like the shade, and also they are not visible there, and that is why they survive there better. So but in those people that were nude, they don't have any clothes, they could not find any ticks, and actually the disease that was reported falsely, so there was not a Lyme disease. So then also the Treponema pallidum is a French disease. Actually, Bushra, do you know what the Treponema pallidum is, the French disease?
No.
Syphilis. The Treponema pallidum leads to syphilis. So do you know why the syphilis called French disease?
Actually, I don't know.
So what do you know? Do you know anything else that is called French?
No.
Like, have you been in France?
Yes.
How many times?
A lot.
A lot. So what is the favorite thing that French people like to do most of all?
Perfume maybe.
What? So have you ever heard about French kiss?
I heard.
Heard?
Yes.
So you know what is French kiss, right?
I'm sorry?
What is the French kiss?
French.
So it is between the people that love each other, right?
Yes.
Okay, so just so, and that is why, and the syphilis is transferred by the lovemaking, and that is why sometimes syphilis caused by Treponema pallidum is named French disease, because French like to make love between men and women. So that is why, and they are good in making love, and that is why French actually uh, French movies usually have more love making, and that is why they're good in that. So that is why this disease is called French disease, because in France people will love making much, and this Treponema pallidum was transferred much, and people died of because of that. So actually French disease, because transferred sexually whilst during the sexual intercourse between men and women. So, and next one is Mycoplasma pneumonia. Mycoplasma pneumonia will lead to the pneumonia like a Streptococcus pneumoniae, but it is called atypical pneumonia because it is not treated by the penicillins and cell wall inhibitors. And also called walking pneumonia, because it is common in community acquired pneumonia, and is usually transferred in the close living conditions like military camps or summer camps, so where people sleep close to each other, or so also uh, in uh, in like the uh, where the people where there are much people in the less square to meter houses, so like some houses that have that are shared by several families. So also treated with the doxycycline. So like you see, doxycycline is a universal treatment for most of the diseases. Then also, yes, Leptospira, we forget about Leptospira, but it is not common, so I don't remember even what is the disease for Leptospira. I think it was some skin diseases caused by Leptospira, but not sure. And then the chlamydial infections include Chlamydia trachomatis, uh, is the also sexually transmitted disease. So it's not called French disease, but still also transmitted by the sexual intercourse, and it leads to the urethritis, pelvic inflammatory disease, and lymphogranuloma veneruleum. And lymphogranuloma is actually a very dangerous complication, and treatment is very complex. So for urethritis and inflammatory disease of the pelvis, it is easier to treat. And some of the chlamydia will lead to the pneumonia, or also hepatitis, myocarditis, and the coma, but usually it's in the form of the urethritis. And also doxycycline is used, as azithromycin is used to treat chlamydial infections too. However, the azithromycin is more expensive. Doxycycline is more expensive than tetracycline, but it is effective for most of the diseases, but azithromycin is even more expensive, but still it's only used to treat the chlamydia infections. So, and the last one is rickettsia. Rickettsia is called will lead to the disease of the Rocky Mountain spotted fever, and the name of the disease is connected to the golden fever. Do you know what is the golden fever? Allah, do you know what is a golden fever? Someone knows what is a golden fever? Who knows? Who does know what is the...
No.
No, you don't know? So
No.
it also was history of America when when people find the goat in the mountains, then the people, most poor people, go to the rocks. They climb the rocks to get the gold and to become rich, and this is called golden fever, because all of them were hunting the gold, and they lived in the camps, and the disease is transferred between them. First outbreak was in the mountains where the people were searching the gold. So during the golden fever, where many people wanted to become rich, and to become rich they go to the mountains and then collected the gold. So they also killed each other. There was
Yes.
some wars between them because the gold was limited, so they wanted to get that gold to themselves and don't want to give gold to other people. And the disease outbreak was first recorded there, and then that is why the name of the disease is Rocky Mountain, because it is the place where people mined the gold. So actually, the first time was uh, seen in miners, gold miners. So, and the bacteria is Rickettsia rickettsii. The symptoms include the fever, chills, and ashes in bones and joints. Also treated by the doxycycline or even tetracycline. So any protein synthesis inhibitor will be effective. So this is the bacterial spectrum, and then the ways of administration include the enteral, so like doxycycline, tetracycline is available orally. Then also they are available intramuscular and intravenous injections. The excretion is by the bile for the doxycycline, and the other tetracyclines are excreted by the urine. So for the tetracyclines,
Sir, can I ask something, please?
sure.
With doxycycline, which give it IV or IM. About the IV, I want to ask. It's forbidden to give it with water solution, right?
No, it's not. Why
Because
do you
I
think?
remember when they make operation for me, they gave me, but they told me it's forbidden to use it with water solution. It must just put it alone.
Alone?
Yes,
Uh,
without water solution, I mean.
of course, without additional water. Usually,
Yes.
additional water is not used.
Why? I just want to know that.
because you should not use water in intravenous injection anyway. And so I think you mean not the water but the solution, right?
Yes, yes, a solution.
So usually intravenous solution is not a water, it is a glucose solution or sodium solution.
Sodium, yes, sodium or glucose.
Sodium. So, but the reason why you don't want to use doxycycline with the you don't need to inject it slowly. You want a rapid injection so it is effective fast. And also,
Ah.
this is the first. And second, with the solution, doxycycline can if this solution have a calcium, and most of the solutions for intravenous injection have calcium because they have potassium, calcium, magnesium, everything. So, and doxycycline will precipitate with the calcium, and so the doxycycline will make a precipitation with the calcium and will not be effective. So the calcium will chemically connect with the tetracyclines and inactivate the tetracyclines. And also any two ion charged uh, ions, double charged ions, will precipitate the tetracyclines. So that will decrease uh, the bioavailability and also completely remove. So the tetracyclines will not be effective, including doxycycline. All tetracycline. That is not only doxycycline. It is all tetracyclines will are not, so will do this thing. So that is why used without any solution, so should be injected directly. And then for the same reason, you should not use a milk to when you take the tetracyclines. So if you use a milk have a high content of calcium, and calcium will will actually precipitate on the tetracycline. So actually chemically they chemically interact with each other. Allah, what is lecture was boring or what?
No, I'm losing my contact, so I starting again.
Oh, okay. If you don't like, just in case I'm recording this, so you can watch later. So, Mustafa, is it clear?
Okay.
Mustafa.
Yes, sir, I am here.
Okay. I mean, is it clear like why the calcium, why they told you don't need a water solution?
Yes, yes, sir, I
Okay.
understand it.
Okay, good. So,
But here is noisy, so for that I turned off the microphone.
okay, good, good. Thank you for that very much.
Thank you, sir. Thank
I
you.
think the Bushra and Allah are also very happy for that. So you turned off the microphone. So
Yes.
so this actually is the explanation. So when you take orally, even orally, same is when you take it on empty stomach, you have good concentration. But if you take it, like for example, blue is with the antacid, like they sell this aluminum. Uh, what is this? What is the name for this substance? Allah, what is the name for this substance?
So it's not aluminum chloride?
Yes, it is not. It's not chloride. It's
It's
OH.
aluminium.
Can you see this?
حامض. يا حامض قاعدة. Sir, it's base, but
It is
I
base.
know it. Base, it's base.
Okay, but what is the name?
I know it.
Hydroxide.
Hydroxide.
Aluminium hydroxide.
Aluminium hydroxide, yes.
Okay, good. So, checking your knowledge of the chemistry, by the way. Good, thank you very much. So, because I studied chemistry a long time ago and I studied it in Russian, so I sometimes forget the names for the chemistry, like for the substances. So, thank you for reminding me. So, this is aluminium hydroxide is the antacid uh, medicine that is usually taken with the it's usually taken to help when you have a heartburn. So do you have heartburns? Mustafa,
Against sir, do we have what again?
heartburn.
Sorry.
Heartburn.
What's mean
When
heartburn?
you feel the acid is going to your
Heartburn.
throat.
Yes, I know. Heartburn. Um, Sometimes, sir, just before when I was so fat, I had it, but now
Okay,
no, I
good.
didn't. I don't.
What do you use as a medicine for that?
Uh, uh, gl- um, I forget its name. Uh, Glogovich. Glovich.
Luggage?
Yes, it's. I forget the medicine name. I just remember the name of the company.
Okay,
It's
so
Glovichin. Glovich.
okay, I think
It's
if you
not.
look,
It's not tablets, sir. It's put it on the mouth and eat it like a gum.
I see. So I think if you look to the composition, it will be aluminum hydroxide or calcium chloride or
Yes.
sodium hydrocarbonate. So three these substances are antacidic. So they react with the acid and neutralize the acid, like a chemical reaction, like neutralization. So and if you and the paradox is that the tetracyclines, when taken on empty stomach, they lead to the heartburn. Then the patients go to the pharmacy and buy antacidic medicine to prevent heartburn. And then this antacidic medicine will bind the tetracycline and then the treatment is not effective. That is why never dispense uh, antacid medicine together with a tetracycline because they, when combined, they will not be effective. And also, if you use a milk instead of the water to take a tablet, so to swallow the tablet, because you need to swallow the tablet, you take a cup of water and drink a cup of the water. But if you like milk, like for children, for example, and you use that instead of the water, for most of the tablets, most of the drugs, it is not a big deal. But when you take the tablet with the take the tetracyclines with the milk, then they will not be active. So that is why don't do that. So the adverse effects include the GI disturbances, that is why heartburn, and then deposition of the drugs in bones and teeth, that is why they are contraindicated um, in children before the age of 18. So actually children and the teenagers as well. Then the liver failure, usually seen in high doses only. Phototoxicity is very dangerous, so especially in Egypt. So if you take a doxycycline, uh, Mustafa, have they told you to avoid sun when you were on doxycycline?
Told me about voice sign.
About avoiding sun?
No, sir.
No?
No.
So have you uh, have you been under the sun after the during the treatment?
No.
No? So
No.
you 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 have been in the hospital, right?
Uh, when?
When you were taking a doxycycline
No, sir. I was home.
at home? Okay. So they should tell you to avoid the sun because
Sir, we have very hot weather, so I was walking on our pa- garage, our park. I'm walking there because I need to walk. I need power because after the operation, I don't have power at all. So I all the time take the sun, but no one tell me to be on the sun.
okay. But you were lucky because sun can lead to the phototoxicity. So probably you use the hat to uh,
Hmm.
to cover the head, right?
Hmm.
No?
Yes,
Yes?
sometimes, but sometimes no.
Okay. So next time be more careful and take the hat because if you don't, then can lead to phototoxicity, and then if that happens, you have burns on your skin. You have to stop the tetracycline. So because if you don't stop, then even if you hide from the sun, then the process is started and then you cannot stop it without stopping the medicine. So you have to stop taking medicine. And then
Yes.
vertigo is the vertigo, like you feel your head is not is rotating, and then contraindicated during the pregnancy. So with the pregnancy, that is why when you start the tetracycline in women of the childbearing age, you should make sure they are not pregnant before administration of the tetracycline, because if some women may not be aware they are pregnant at the first weeks of the pregnancy, so before their first menses. So like usually women are aware of the pregnancy after the delay of the menses. So, but before, because menses are only once a month, then they cannot be aware at the early stage of the pregnancy. So, the uh, so that was tetracyclines, and then aminoglycosides are also indicated for the tularemia. Tularemia is spread by the rabbits and usually seen in the hunters that skin infected rabbits. So do you like rabbits? Ladies, do you like rabbits? Rabbits.
I don't, sir.
Why?
Yes, a lot. I like
Allah,
it.
you like? Okay,
Sir,
Bushra?
we have some thoughts that it's give a
Yes,
bad
a
luck.
lot.
What, Mustafa?
I said we have some thoughts in
No.
our in my country that it's give a bad luck.
Bad luck. Okay, and
Yes,
Bushra?
so we don't like it.
Okay, and Bushra, do you like rabbits? Bushra, rabbit. It's so cute. You don't like it? Okay. So anyway, even
بس
if
يعني
even if you don't like rabbits, do you like eating rabbits? Mustafa,
no at all.
Allah
We
don't
like
like
what, sir?
eating rabbit meat. Rabbit,
I tried one
Eating.
times and I didn't like it.
you also don't like. Okay.
I tried before, but I didn't like it. We have
Okay.
ale, if you know it. The ale meat, we love it so much.
And what is elk? Oh, I see, I see. So, but it is very expensive, I think.
Yes, it's very expensive, but it's very delicious.
Oh, yes, it is.
Yes.
Okay, good, good.
Hmm.
So, uh, actually, I think most of the people like rabbits because they are very cute and they are very firm is very uh, silky. So, especially children, children like rabbits very much. And so, but you should be careful with the rabbits. Uh, they can bite you because they have uh, uh, very uh, strong teeth. So, and rabbits are not affected by the disease, so they don't have any symptoms, so they are fine. Like, and the bacteria will not harm the rabbits. So, and I think Mustafa,
Mm-hmm.
in your country, like they don't like the rabbits, like a bad luck, because the rabbits can lead to disease that is called the tularemia. Tularemia is actually mostly caused by the rabbits, and the also even the name of the bacteria is called Francisella tularensis. So actually, uh, that means caused by rabbits. So actually, I think that is the reason, Mustafa. So that people in your country believe that rabbits cause bad luck.
So they said in my country some words like popular word. Put one rabbit in your home and you will lose $1,000 every day.
That's true because the treatment with the gentamicin is very expensive. Actually, you have to gentamicin should be injected
So,
intravenously. So
sir, but the cats have they make some diseases to the girls with pregnancy, and they don't said anything about that.
pregnancy.
Yes, but when you put a cat in your home and there is a girl living there with this cat, in
Okay.
the future maybe the girl will not be pregnant because the cat she have some diseases, make problem for the girls. It's true.
Yes, it's true too, but it is not because of the cat, it is because of the bacteria that is in the cat. See?
Yes. So it's dangerous too for the girls, but nothing said anything about it. In my country, I love the cat so much.
Okay, it's usually common in France. The
Yes.
disease. This
Yes.
disease is common in France. That is why in France they have also a rule that uh, the women are not encouraged to live during the pregnancy in the home where the cat is living or have been lived before. So anytime, because once the cat is in the home,
Also in Egypt, they are saying something like this.
okay, it's true, but the reason is not the cat itself. It's not like bad luck or like something bad about the animal. It is the bacteria that is spread by the animal. And the bad thing is that this bacteria uh, spores so cannot be cleaned by any cleaning. Like even if you clean everything tidy your home, it will still be contaminated. So that is why cats are not good uh, in so for in terms of the bacteriology and microbiology, so they spread the diseases more than other animals. Like dogs are better. So that is why if you want a pet, take a dog instead of the cat. But children also like cats and dogs, rabbits, everything, all animals because they're cute and they actually play with the cats, with the rabbits, with the dogs, and they like animals very much. So this is only for the adults. So tularemia is actually a respiratory disease, and so when the hunters skin the animals, the drops of the blood will be breathed by the uh, lungs, and then will contaminate the lungs and then go to the blood through the lungs. And that is why this is a blood disease, and it will result in lymphoid or uh, disruption. So, and that is what not treatment is complicated because of the lymphoid uh, disease. So it's moved to the lymphoid tissue. Then uh, the aminoglycosides can be combined with the ampicillin before the surgery to prevent the gram-positive cocci infections. And then the also the most common prescription is to treat the Pseudomonas aeruginosa, because Pseudomonas aeruginosa is resistant for the most of the penicillins, but is effective. So that aminoglycosides are effective against Pseudomonas diseases. Then other diseases include tularemia, so actually, and Klebsiella species, and Yersinia pestis is also causing plaque, and plaque is not common nowadays because it's spread by the rats. So if you don't like rats, so this is because people don't like rats because they spread the plaque. The plaque is was very dangerous because when there was no treatment available. So actually almost killed the whole London and whole Paris, and like cities were killed by the plague. So the aminoglycosides will not penetrate the central nervous system and used topically, intramuscularly, intravenously, and intrathecally. Intrathecally, they are used to treat the infectious diseases of the central nervous system, and they are excreted by unchanged in the urine by the urine. So there is no oral administration. So those of you who prescribe aminoglycosides in tablets are so this prescription cannot be filled. So that is why only parenteral and topical. Topical is only on skin diseases. So if you want a systemic effect, then you have to inject it intramuscularly or intravenously. Usually intramuscularly. Intrathecally is very dangerous, can be done only in the hospital with a surgeon. So there is no tablets for aminoglycosides, no tablets. Please remember that, it's very important. And then the adverse effects include things first, ototoxicity. Ototoxicity is very common and is non-reversible. So that is why contraindicated in people with a hearing diseases, and also contraindicated when combined. So don't combine with the other drugs that lead to ototoxicity. So when you dispense, please check every time if several drugs are in one prescription, and make sure there is no other drug will lead to the ototoxicity. Then nephrotoxicity is also common, so that is why treatment So in healthy adults, no problem, but in case of the uh, damage, in case of the uh, uh, damage to the nephrons, so with the liver of so with the nephron diseases should be contraindicated, and paralysis is rare, and skin rashes are very common. So skin rashes is a normal allergy, not phototoxicity, but just skin rashes uh, is should be the medicine should be discontinued in case of the skin rash. Bushra, have you ever had a skin rash from the aminoglycosides?
I'm sorry?
Have you ever had a skin rash allergy from aminoglycosides?
Yes.
Really? When?
No, not from amino glycoside,
Okay, but
but with another.
drug.
Yes.
Okay, I see. So actually, then I think aminoglycosides are contraindicated too because they also cause skin rash. So make sure that you don't take this because probably they will cause a skin rash to you. So don't use that. Okay?
Okay. Yes.
Oh, good. So this is common side effects. So because you had a skin rash from other drug, probably you will have to. So be careful. So then the macrolides uh, are more effective, so and more expensive, and the macrolides have a microcyclic lactone structure. So it is also chemical. So chemical structure is macrocyclic. So that means that the cycle is large. Like usually we have six carbon cycle, but cycles can be 7, 8 times large. So uh, uh, and there are some deoxy sugars attached to that cycle. Erythromycin was the first macrolide that uh, that were used in the hospital, and it is used in Bushra, do you have allergy to penicillin, right? Bushra.
Yes, I have.
So if you have allergy to penicillin, then you can use erythromycin instead,
Uh-huh.
because they have the same antibacterial spectrum, like they are effective the same diseases, but erythromycin will not cause an allergy in your body.
Mm.
You see?
Mm-hmm. Yes.
So you know that you have an allergy for the penicillin, then if a physician wants you prescribe you a penicillin, tell thank you very much, I prefer erythromycin. Okay. Then
Yes.
physician will be very very uh, uh, like uh, surprised. Why do you know what's erythromycin? Look, so I like she's knowing more than me. Really. So she's not a physician, she's just a pharmacist. Just a fucking pharmacist and knows more than me. Really. It's very interesting. So erythromycin actually um, the drug of choice as an alternative to the penicillin for the Bushra. So special drug for the Bushra. And so also the clarithromycin is most commonly used macrolide, and azithromycin also used commonly because they are better than erythromycin, because erythromycin you have to inject it uh, intramuscularly, but clarithromycin, actually erythromycin now you have also a tablet, but still clarithromycin is have a larger spectrum, antibiotic spectrum. The Also, the mechanism of action we discussed already is acting on the S50 subunit, and the antibacterial spectrum is including the Corynebacterium diphtheria, erythromycin is usually used as for the Corynebacterium diphtheria, because diphtheria is actually gram-positive disease, and so also cover the gram-positive cocci is covered, including Streptococcus pneumoniae. Gram-negative is Moraxella catarrhalis Moraxella catarrhalis and Neisseria gonorrhea. So gonorrhea is also sexually transmitted disease that can be treated with penicillins and beta-lactams, but so it can be treated by the by the macrolides too. So actually very common disease, Neisseria gonorrhea, transferred sexually, and then the Bordetella pertussis will cause the typhus. The Campylobacter jejuni will lead to the central nervous system disease. Haemophilus influenzae will lead to the influenza-like disease that is not the virus. So the symptoms are the same as with the flu, but it is not the virus, it is the bacteria. But this bacteria is very hard to detect. So if you look under the microscope, you cannot see the bacteria. It's very small, so you have to make a special stain to see it under the microscope. That is why it's hard to detect the bacteria. And the Legionella pneumophila. Legionella pneumophila is the this leads to the legionellosis, and it is very dangerous because will lead to the death. And the first several months the disease is asymptomatic, and but the people will spread the disease. So it's called legionellosis because the first outbreak was during the meeting of the legionnaires. Legionnaires were military soldiers that have annually meetings, and during one of these meetings some of them would have disease and they spread. Then the meeting was over, they returned to their homes all over the country, and they spread the disease, but they were not aware because the disease is asymptomatic. It is like a COVID. COVID is also asymptomatic, and like that is why it's hard to distinguish from the common flu, and that is why it was spread so fast throughout the world. So the same as the legionellosis. And I think Allah disconnected again. So
Because she has problem with network.
yeah, so I am aware that's fine. Anyway, we have a recording, so then we will.
Okay.
If you miss something, then you can repeat.
Mm-hmm.
So the also the Trypanosoma pallidum is actually French disease or syphilis, very common in Russia. So if you want to spend a night with a girl in Russia, first question you should ask, do you have a syphilis or not? So then if she has a syphilis, then you should prescribe actually erythromycin to the girl first, and then you can spend a night with the girl. So and then Mycoplasma pneumonia is a mycoplasma type that is also hard to detect. So like a like a if like a Haemophilus influenza, and that is why it lead to the atypical pneumonia, and usual bacteriologic techniques cannot isolate the bacteria, because uh, special uh, technique is required for the growth. Like, do you use agar agar in microbiology? Have you
Yes.
have you
Yes. Yes. Yes.
cultivated the bacteria? So
Yes.
so this agar
With
agar
blood agar and another.
and a peptide soup,
Yes.
peptide soup. So these techniques are not effective. So mycoplasma uh, is very specific. It does not like agar agar. It does not like the uh, the soup, the peptide soup. So requires a special condition to growth. So it's very uh, expensive to grow the mycoplasma. So and then chlamydia is caused by mycoplasma chlamydia pneumonia, and pneumonia will lead to the lung disease. Pneumonia trachomatis will lead to the bone disease. Psittaci will lead to the skin disease. So different diseases by chlamydia. And then the last but not the least, the Microbacterium avium is seen in the birds. So Mycobacterium avium complex is transferred by the birds, and is also very dangerous. Uh, so this complex, so this bacteria usually will kill the patients with AIDS. So patients with the AIDS have a virus of the AIDS. That is why they have a compromised immune system. And usually Mycobacterium avium complex is not dangerous for the people unless they are AIDS positive. So, and that is why the azithromycin is used as a prophylaxis in patients with AIDS. So actually, they also use the antiviral drugs against the AIDS, and then additionally they use azithromycin, but not against the AIDS, but for the prophylaxis of the Mycobacterium avium complex, because the azithromycin is not effective against the virus. It is the antibiotic, not antiviral. So this is the bacterial spectrum, and the drugs do not penetrate through the central nervous system, but there are tablets available. That is good. So you don't need to inject it intravenously, but later, before the tablets were available, you have to inject it intravenously. So that is why expensive treatment, because you need a nurse to inject intravenously. You cannot inject it yourself, or you need to have Allah to inject it intravenously. Allah. So how do you learn to or where do you learn to inject intravenously? Oh, Allah is this line. Sorry. So actually, Bushra, do you know how Allah learned to inject intravenously?
I'm sorry?
Do you know where Allah learned to make an intravenous injection?
In first aid.
No.
Where?
And do you know how to make an intravenous injection?
Yes.
Have you tried to make an intravenous
Yes.
injection with a
But not with the real human.
okay,
Hello.
but with a real human?
No.
No. And Mustafa? Baha, hello. You are late.
My internet was so bad.
Baha, no problem. Recording is on. Watch online afterwards. Download video on YouTube or watch online. And
Okay.
subscribe to my channel. So I have more subscribers. I only have 4
Well,
now.
you have a channel on the YouTube?
Of course I have. Baha, what's the question?
Wow, that's cool. Give us the link. I'm
Okay,
gonna
I will give
subscribe
you
and
offer.
like, follow.
Sure, offer, sure. Thank you very much for that. So, Mustafa, have you ever tried to make intravenous injection to the real human?
Yes, sir. I tried before.
Tried? When?
Yes.
Where?
In my country, one day I had my cousin. He used insulin, and he fell down, and they need to give him insulin. Everyone was afraid to give him, so I gave him. But it's not in intravenous injection, but it's insulin. I don't know. It's scary.
Intramuscular. It's intramuscular.
Yeah.
Okay, one moment.
Intramuscular.
One moment. We will make a short break, okay?
Okay. صاحبتها دقت.
ما أدري يا أخي.
Okay, guys. Let's stop here. Then we will continue next
Okay.
day. Okay. I think
Okay.
it's fine for today. See you next week. Bye bye.
Bye.
Bye bye.